This is the clavicle, and this is the right clavicle. What's important for us is the groove, which is present in the undersurface of the clavicle. This groove is groove for the subclavius muscle, for the insertion of the subclavius muscle. So, we are not concerned about this is the sternal end, and this is the acromial end, and this is the anterior surface, and this is the posterior surface. And the upper surface here is smooth, and the lower surface here will find ridges and grooves and rough. What's important for us is the groove for the subclavius muscle, which lies in the inferior surface of the clavicle. So this is the right clavicle. Sometimes we get the left clavicle. This is the left clavicle. This is the sternal end, this is the acromial end, superior surface is smooth, and the inferior surface you can find ridges and the groove. This is the groove for the subclavius muscle, insertion of the subclavius muscle. So this is what's important in this clavicle. Only the groove for the subclavius muscle. Concerning the femur, this is the left femur. It has an upper end, it has a lower end, it has a shaft. What's important for us is its upper end, which contains, this is the head of the femur, and this is the neck of the femur. And this is the greater trochanter of the femur, and this is the lesser trochanter of the femur. And this is the intertrochanteric line from the anterior surface. From the posterior surface, this is the intertrochanteric crest. This is the important features of the upper end of the femur. This is the head, and this is the neck, and this is the greater trochanter of the femur, and this is the lesser trochanter of the femur. This is the intertrochanteric line, the edge between the neck and the shaft. This is the intertrochanteric line. And posteriorly, there is intertrochanteric crest. What's important for us is this. This is the lesser trochanter of the femur for the insertion of the iliopsoas muscle. You know, the psoas major muscle and the iliacus muscle, both are inserted into the lesser trochanter of the femur. Also, this head articulating with the acetabulum of the hip bone to form the hip joint. So we don't concern about the lower end or the shaft, but only the lesser trochanter of the femur for the insertion of the iliopsoas muscle. Concerning the hip bone, this is the left hip bone, and this is the right hip bone. You know, the hip bone is formed of 3 bones. This is the pubic bone, and this is the ilium, and this is the ischium. And the 3 bones unite with each other at the acetabulum. And this acetabulum articulates with the head of the femur to form the hip joint. What's important for us for this hip bone? This is the pubic bone, and this is the body of the pubic bone, and this is the superior pubic ramus, and this is the inferior pubic ramus. Here you'll find 2 ridges. This is the most prominent one is the pubic tubercle, and this is the one which is medial to it is the pubic crest. The pubic crest. So this is the most important thing to identify which of which. If we look to this bone, you'll find the most prominent one, this is the pubic tubercle. And this area is the pubic crest. And this is the site of the symphysis pubis, where the two bodies of the hip bones articulate with each other in the middle line. So, in the practical exam, I can mark this anterior, the pubic tubercle, and say identify the colored area, pubic tubercle. I can mark it, identify structures attached to the colored area. This is the inguinal ligament. Sometimes I mark the pubic tubercle and say name the structures above and medial to the colored area. Which passes above and medial to it is the spermatic cord. The spermatic cord. The spermatic cord. Sometimes people will answer it that the oblique inguinal hernia or indirect hernia, because indirect hernia passes inside the spermatic cord, and the hernia when it passes above and medial to the pubic tubercle. So I can mark it and say identify the colored area. So it will be pubic tubercle. The other question, I can mark it and say the structures attached to the colored area. So it will be the inguinal ligament. Sometimes I mark the pubic tubercle and say name the structures lying above and medial to the colored area. Which lies above and medial is the spermatic cord. And inside the spermatic cord is sometimes in patients with hernia, the indirect inguinal hernia will pass also above and medial to it. So both answers are correct. If you say the spermatic cord is correct. If you say indirect hernia passes here, it's also correct. Concerning this is the pubic crest. The pubic crest, and this is the pubic tubercle. The pubic crest here, sometimes we mark it and say identify the colored area. You will say this is the pubic crest. Sometimes name structures attached to the colored area. The colored area here is the pubic crest. Here the attachment of the conjoint tendon. If you say conjoint tendon, it's correct. It is also the rectus abdominis muscle. It will be also correct if you say the crest. The origin of pyramidalis muscle also from the pubic crest. So three structures can be the answer. If I mark the pubic crest and say name structure attached to the colored area. So you can mention only one structure, pyramidalis muscle is correct. Rectus abdominis muscle is correct. The conjoint tendon is correct. Sometimes the question is name the tendon attached to the colored area. And I mark this pubic crest. So tendon means conjoint tendon. So I mean it. I mean the conjoint tendon because this is the insertion of the conjoint tendon. And this is the symphysis pubis, the joint between the body of the pubic bone. This is the superior pubic ramus, and this is the inferior pubic ramus, and this is the obturator foramen. Concerning here, I'll find this is the pubic bone, this is the ilium, and this is the iliac crest. This is the iliac crest. And here is the anterior superior iliac spine. The anterior superior spine can be marked also because this is the attachment of the inguinal ligament. The inguinal ligament passes between the pubic tubercle and the anterior superior iliac spine. So if I mark this area, identify the colored area, it will be the anterior superior iliac spine. If I mark it and say name the structures attached to the colored area, I mean the inguinal ligament. This fossa is the iliac fossa for the iliacus muscle. This is one of the muscles of the posterior abdominal wall. Psoas major muscle and iliacus. So I can mark this fossa. and say name structures attached to the colored area, iliacus muscle. Or I can mark it and say name the colored area, iliac fossa. And this is the articular surface for the ilium. This articulates with the articular surface for the sacrum to form the sacroiliac joint. To form the sacroiliac joint. So if I mark this area, this is the auricular surface for the ilium, or the articular surface of the ilium. It articulates with the sacrum, and it is related to the sacroiliac joint. So if I mark it and say, identify the colored area, auricular surface of the ilium. If I mark it and say, name structure related to the colored area, so I will say it is the sacroiliac joint which is related to it. This is the main features we need in this pubic, in this hip bone. If we say this is unarticulated, and this is the sacrum. Sacrum is triangular bone. This is the first sacral vertebra, second, third, and the fourth, and the fifth sacral vertebra. They are uniting together. And here is the anterior sacral foramina, 4 anterior sacral foramina. And this is the ala of the sacrum. And this is the ala of the sacrum. And this area which is projecting forward is the promontory of the sacrum. Is the promontory of the sacrum. And here is the sacral canal, which is end posteriorly here at the sacral hiatus. And this is the posterior sacral foramina. And this is the sacral crest. So this is the main features of this sacrum. What's important for us, if we mark the middle 3 pieces here, this is the insertion for the piriformis muscle, origin of the piriformis muscle. You know the rectum, and posterior to the rectum was the piriformis muscle with the sacral plexus on it. So the insertion of the piriformis muscle from the middle 3 pieces. This is what's important. Also, this auricular surface for the sacrum, it articulates with the ilium to form the sacroiliac joint. This is by far the commonest things about the sacrum concerning this block. And this is the articulated sacrum. This is the sacroiliac joint. And this is the anterior superior spine. And this is the pubic tubercle. And this is the pubic crest. And this is the acetabulum for the head of the femur to form the hip joint. Anterior superior spine. This is the iliac crest. And this is the iliac fossa, or sometimes iliacus fossa. This is for the iliacus muscle. It's called the iliac fossa. And also this is the iliac fossa for the iliacus muscle. And this is the sacrum. And this is the lumbosacral joint. This is the disc between the 5th lumbar and the 1st sacral, the sacro-lumbosacral joint. This is the ala of the sacrum. And here is the origin of the piriformis muscle. So this is by far the commonest feature we need in this block concerning the pelvis. Concerning the lumbar vertebra, I have to identify that this is lumbar vertebra with transversal process passing backwards and rectangular in shape and thick. And it has a body which is kidney shaped. And this is the vertebral canal. And this is superior articular facet. And this is the transversal process for this lumbar vertebra. So I have to identify that this is lumbar vertebra. Sometimes we mark the upper surface of it and say name the structure related to the colored area. Here the structure is the intervertebral disc between the lumbar vertebra. I have to identify that this is lumbar vertebra, and also the structure which is marked here, we are not concerning about it now, but sometimes we mark the transversal process because this is the origin for the psoas major muscle. Because the psoas major muscle, it arises from the transversal processes of the old lumbar vertebra and the side of the bodies. So if we mark the transversal process anteriorly, so we mean that the origin of the psoas major muscle, which belongs to the posterior abdominal wall. This is the main feature, the disc and the psoas major muscle. شكراً.